If you would like to use the AI diagnosis support tool, please click on this URL. Please log in using the username and password provided. If you are using English, please change the pull-down menu next to the language on the screen to EN. Now, let's enter number 78 from Visual Training Volume 3, Essential Clinical Problems for Internal Medicine Specialists, as an example. It is a fever, so please enter fever. From the list of symptoms, select fever, high body temperature, high temperature, hyperpyrexia. It says skin rash, so please enter skin rash. From the list of symptoms, select skin rash, rash, toxic rash, painful rash, freckles, painful skin/pain on skin contact. It says pain around vulva, so please enter pain. Many symptom lists will be displayed for pain, so please enter external genitalia. From the list of symptoms, select external genitalia abnormality, unclear genitalia shape. It says pruritus, so please enter itching. From the list of symptoms, select itching, do not make the part a problem. It says swollen lymph nodes, so please enter lymph. From the list of symptoms, select lymphadenopathy/adenopathy. Take no account of the property/location. It says erythema, so enter erythema. From the list of symptoms, select erythema, skin lesion, discrete erythematous patches, flagellate erythema. This completes the input. This question asks you to choose one possible disease name. The answer is syphilis. In the AI diagnostic tool, syphilis is displayed at the top. This concludes our explanation of how to input symptoms and other information into the AI diagnostic support tool. In the second half, we will explain various points to note when entering information. We are also interested in error studies and believe in the power of computers to overcome them. Specifically, I believe that it is important to always go back to the beginning of the diagnosis, carefully recall the differential diseases, and approach the correct diagnosis or correct the wrong path, using the method of clinical problem solving. For this purpose, I thought I needed machine performance like the URLs I will introduce later. Please give it a try when you have time. Currently, I have about 6,850 diseases in total, with 1,000 records in series and differential diagnosis of disease in parallel. The following is an annotation of the input on the web. The symptom dictionary can be searched in English. Instructions for use. 1. Please write a part of symptom or findings you want to input in English in the frame and search. For example, if you have abdominal pain or fever, enter abdominal or fever respectively in the search box. And if there is a corresponding entry in the dictionary, it will be selected and displayed in the left frame. At the same time, there is an English dictionary function, so you can use ABD or FEV. Once you have checked the boxes, 20 records sorted by score will appear in the lower right frame. The upper right frame shows the symptoms and findings you have checked. In this way, as you search and check, the corresponding diseases listed in the lower right corner will appear in accordance with the change in the list ranking. If you check the box again, the check mark in the square will be removed. If you want to select a disease again, do the same thing as before. 2. If you have a symptom that can occur anywhere in the body, such as an enlargement, swelling, edema, or mass, please enter it roughly. It can only be done that way. Nodules, masses, and tumors are all used interchangeably. 3. Abnormal findings on X-ray images should be searched and checked as chest, for example. In this case, you can only enter a general description such as abnormal chest radiograph. The same applies to abdominal and skeletal lesions. 4. ECG abnormalities can only be entered as ECG. The same is true for heart murmur, respiratory sounds, etc. 5. Skin rash, perceptual abnormality, sensory abnormality, tendon reflex abnormality, gait disturbance, etc. are not differentiated by their nature, intensity, left or right. Skin rash can be selected as such if it is clearly identifiable. 6. Left-right differences in symptoms and findings, and numerical values are not taken into account at all. Judge them based on whether they are positive or negative, high or low. It is not possible to specify the exact location of headache, abdominal pain, etc. 7. Smell and taste, qualitative and quantitative, are indistinguishable. Abnormal sense of smell and taste can be entered. 8. Disorders of consciousness, mental disorder, emotional disorder, etc. can be distinguished somewhat, but please enter them roughly as you feel. 9. Risk factors and underlying diseases can be selected, but please be careful when using them. 10. In some cases, you may be given 2 choices. Please check one of them. If you don't see the symptom or finding you want, please ignore it. 11. Vindicate may be applied, but it is more extensive. 12. If you have any symptoms or findings that you really need, please contact us. Email nmdshjcg@gmail.com. Please also send us feedback information. Supplement. The left frame is the dictionary, the upper right frame is the selected items, and the lower right frame shows the diseases up to the 20th place. For each selected symptom, the possible diseases will be output while changing. The list of diseases will change as you uncheck or recheck items, but I hope you will be able to find the right diagnosis by looking at them. This concludes the explanation of how to input symptoms, etc. into the AI Diagnosis Support tool. If you wish to use it, please access this URL. Please log in using the username and password provided.